What is the cost of hair transplant? In this video, we are going to discuss the various factors contributing to the cost of hair transplant in Delhi, Mumbai and different clinics all across India, and why do different clinics charge differently for hair transplant. Greetings friends, I am Dr. Preeti Saraswat. I am a diplomate of American Board of Hair Restoration Surgery, which is the highest certification in the field of hair transplant. I serve my hair transplant patients at all Twacha by Saraswat centers, including Delhi NCR, Gurugram and Agra. I also work as a faculty at ICSAM, which is International Institute of Cosmetic Surgery and Aesthetic Medicine, and which has trained more than 86 doctors from 27 countries till date. Hair transplant is one of the most commonly done cosmetic surgery and is also one of the safest one. At our center, hair transplant is done under local anesthesia, following all international guidelines, because your safety is our first priority. At the end of this video, I will discuss a method by which you yourself will be able to find out whether your hair transplant will be a success or not. I have divided this video into 11 points. Hair transplant surgery cost depends upon many factors. Let's analyze. Point 1. Credentials of the doctor. You would definitely like to undergo hair transplant by an expert surgeon who is also a master in the art of hair transplant. You must be seeing a number of hair transplant clinics around you, but instead what you should be searching around you are hair transplant doctors. Let me tell you that in the field of hair transplantation, Diplomate of American Board of Hair Restoration Surgery reflects highest expertise of your doctor. Search for doctors who keep themselves updated with latest advances in techniques and researches. Such doctors should naturally be your first choice. Attending world congresses and CMEs like the ISHRS, which is International Society of Hair Restoration Surgery, is important as updated knowledge they get from there benefits their patients a lot. Number 2, credibility. When consulting your hair doctor, please look at the approach they have for your problem. You deserve the best informed decision. Our work as hair transplant surgeons is to tell you all possible techniques, offer you the latest, and then help you choose the best for yourself. Please go through the testimonials of our post-hair transplant patients to have a feel of the procedure. Number 3, trichoscopy. Right at the time of your first consultation, we do a computerized hair analysis for you, which is called trichoscopy. The word comes from tricho, meaning hair, and scopy, meaning to see the magnified image. So when we see a 50 times magnification of hair, we find out its microscopic characteristics. It is a great tool as it suggests what the reason of your baldness is, what results can we expect from your hair transplant, how big is your scalp donor area, and how many grafts can be procured from it. It also helps us to understand details about your other donor areas like beard, chest, back, etc. A special calculation called torso donor index is used for this. Thus you see friends, trichoscopy helps in hair and scalp examination and treatment planning in a very scientific and methodical way. Number 4, proper planning. Nowadays we see many patients asking us about, Doctor, please do our FUT or FUE procedure. Well, a good consultant would explain to you pros and cons of both the procedures and guide you before doing any of them. First, we decide what is best for you, with you, and then perform whatever is required. It may be FUE, FUT, or a combination of both. I have a message for all those patients who have scanty scalp donor area. Please do not be disheartened. We can get donor grafts from beard, lower chin, back, chest, even arms and legs to cover your baldness. Then there are also patients who want hair to be grafted in different areas of the body, like beard, mustaches, underarms, and other areas. This procedure is available as well. The message to take home is that when you come to us as a hair transplant patient, we should do a realistic long-term planning for you. Number 5, consumables. Consumables are those things which are consumed during the hair transplant procedure. They should be standardized and of best possible quality. Punches are used to score FUE grafts by FUE machine. The FUE machine being imported, the punches are imported too and are of best quality. Centers which use locally made poor quality punches can cut the cost of hair transplant. Best quality punches are made with precision and they cost somewhere between $50 to $200 per punch. Please ensure the punches are new and of best quality. Beware of low-rate hair transplants with reused punches of poor quality. Machine and counter. The ideal FUE machine is that which on lowest RPM scores gently with minimum force and minimum torque. By this, graft gently pops up above the scalp surface. In hair transplant videos of our center, you will be able to see a 600 to 1200 RPM machine scoring gently and popping up the grafts above the surface. Also, a good FUE machine should have both rotation and oscillation modes. FUE machine has a graft counter too, which everyone can see, thus making graft harvesting procedure a completely transparent one. Your payment for grafts absolutely matches the graft harvested. A word of caution here. Many clinics claim simple dental drill as robotic hair transplant. The only robotic hair transplant machine approved by US FDA is ARTAS. Number 7. OT facility and pre-op investigations. Properly sanitized and fumigated OT facility, COVID protected and disinfected as well as sterilized center, autoclaved gowns, PPE kits, multi-para monitor, emergency kits, defibrillator, central supply of oxygen, facilities all according to international norms are a necessity. Handling hair grafts is a delicate work. Staff should wear magnifying loupes, preferably a standard quality Carl Zeiss loupes. For sliver cutting in FUT, Zeiss operating microscope should be used for best quality grafts. We ensure that you undergo proper pre-operative investigations like routine investigations, LFT, KFT, COVID-19 related tests. If indicated, ECG, echo or any other special tests. Physician's pre-surgical checkup also can be done. Only then we take you for your surgery. Number 8, the team. Hair transplant is a teamwork. All team members work at different stations with their own magnifying devices. We can understand now the 3 steps of hair transplant and how we do it. Step 1 is a recipient site preparation. Preparation of the site where grafts are to be put, taking care of angle, direction, density and depth because the hair will grow in the way the doctor makes the slits. Step 2 is graft harvesting by follicular unit excision method, that is FUE, or a linear strip harvesting method, which is FUT. At our center, only doctors do this work. Step 3 is grafts insertion, that is to slide grafts into slits which the doctor has already made. World over, doctors take help of their trained, skilled staff to do this work. This is a skilled work too. Manhandling cannot be tolerated. So qualified, trained, experienced staff is absolutely necessary. Some of our staff are Dubai Health Authority certified. We at ICSAM offer a hair transplant staff training course too. You can see the link in the description below. In a good hair transplant team, technical staff is permanent. Doctor and his team discuss every case before the procedure and then proceed with the procedure. In a few centers, we see that there are freelancing technicians who perform the cases. Sometimes they perform the maximum or even all the steps. These hair transplants can be cheaper, but they always carry a high risk of being botched up. Such surgeries have been termed as #black market hair transplant. Number 9. Receipt of the procedure. Always ask for the receipt of the hair transplant procedure from your center so that you know that the center has paid 18% GST, which you have paid to the center, and you have a document in your hand which shows you underwent a procedure from that center for all the future references. If a center is not providing you a receipt, you may feel you have saved quite a number of money. But in case of any problem, the center may not take any responsibility. Number 10. Hidden cost. In some clinics, they give you the quotation in the form of per grafts or per hair. If a clinic has given you a quotation of fees for your procedure, please check if it is per hair or per graft, because one graft or follicular unit can have 1 to 4 hairs. On an average, single graft has 2 hairs. Please check inclusions in your fees. Also see whether the center has included investigations, PRP therapies, medicines during the procedure and after the procedure, operation theatre charges, and so on, and it is not a hidden cost in your fees. Number 11. Special hair transplant expertise. Special cases like redo repair, beard hair transplant, underarms, eyebrows, hair transplant, or body to scalp may require special instruments, and so they are a little expensive. Hair transplant cost in India is from INR 10 to 15 to INR 150 to 200 per graft. Centers which take care of more things usually spend more and do better quality hair transplant, and so they charge more. Exact cost of hair transplant depends on these factors mentioned in the video. And now for the secret tip, I would like to tell you to find out whether your hair transplant will be successful or not. I will ask you 10 questions. You will have to write down whether it is a yes or no. Please take a paper and pen. Each yes carries 1 point. Your score in the end, when multiplied by 10, will tell you the percentage chance of success you have for your hair transplant. Number 1. Donor hair quality at a scale of 1 to 10. 1 being thin, soft, silky thread-like, and 10 being toothbrush-like bristles. If the thickness is 7 or more, it's a yes. Give yourself 1 mark. Number 2. Doctor's credentials. Is he or she a diplomate of ABHRS and a full member of ISHRS? Yes or no? Number 3. Trichoscopy finding on consultation. If the density of follicular unit at donor site is 80 follicular unit per square centimeter or more, then it's a yes. Number 4. Trichoscopy finding on consultation. Is terminal to vellus hair ratio at donor site 9:1 or 10:0? Yes or no? Number 5. Does the center use fresh imported punches in every case? Yes or no? Number 6. FUE machine. Does it have low RPM 600 to 1200 rotation per minute and an electronic counter? Yes or no? Number 7. Is there a permanent team? Yes or no? Number 8. Does the center use Carl Zeiss or any other standard magnification devices? Yes or no? Number 9. Does the center or team has special area hair transplant expertise? Yes or no? Number 10. Does doctor do local anesthesia, slit making and graft harvesting himself or herself? Yes or no? Now you multiply your score by 10. The answer is your chance of success of hair transplant as a percentage. If you need any more information on hair transplant, please write your phone number in the comment box below and we would be happy to help. Hoping this video educates you in your quest of hair transplant. Thank you.